Causes and symptoms of non-anemic iron deficiency. Non-anemic iron deficiency, also known as iron deficiency without anemia, occurs when the body lacks sufficient iron but has not yet reached the stage of developing anemia. Anemia is a condition characterized by a decrease in the number of red blood cells or a decrease in the amount of hemoglobin in the blood. Causes of non-anemic iron deficiency may include inadequate dietary intake. Not consuming enough iron-rich foods in the diet can lead to insufficient iron levels in the body. Blood loss. Chronic blood loss, such as from gastrointestinal bleeding, ulcers, polyps. Inflammatory bowel disease, or excessive menstrual bleeding, can deplete iron stores over time. Poor iron absorption. Certain medical conditions, such as celiac disease, inflammatory bowel disease, or gastrointestinal surgeries, can interfere with iron absorption in the digestive tract. Pregnancy and lactation. During pregnancy and breastfeeding, a woman's iron requirements increase, and if not adequately met through diet or supplements, non-anemic iron deficiency can occur. Intense exercise. Athletes, especially female athletes, may be at risk of non-anemic iron deficiency due to increased iron needs and potential dietary imbalances. Symptoms of non-anemic iron deficiency may include fatigue and weakness. Even before anemia develops, inadequate iron levels can lead to feelings of fatigue and weakness. Pale skin. A pale or sallow complexion may be noticeable in some cases. Cold hands and feet. Reduced iron levels can affect circulation, leading to cold extremities. Brittle nails and hair. Insufficient iron can affect the health of nails and hair, making them brittle and prone to breakage. Difficulty concentrating. Reduced iron levels may impact cognitive function and lead to difficulties in concentration and memory. Restless leg syndrome. Some individuals with non-anemic iron deficiency may experience restless leg syndrome, a condition characterized by discomfort and an urge to move the legs, especially during periods of rest or sleep. Increased susceptibility to infections. Iron plays a role in immune function, so inadequate levels may increase the risk of infections. It's essential to recognize and address non-anemic iron deficiency to prevent it from progressing to iron deficiency anemia, which can have more severe consequences. If you suspect you may have iron deficiency, it is recommended to consult a healthcare professional. They can perform blood tests to assess your iron status and provide appropriate recommendations for dietary changes or supplementation, if necessary. Hope you liked the video and thanks for watching. Please don't forget to like, subscribe and support our channel, Miss Healthy.